A new report says there is a higher percentage of children in rural areas enrolled in Medicaid than those living in urban areas. And the same is true for non-elderly adults. The report comes from Georgetown University Center for Children and Families. They're using U.S. Census Bureau data for their findings. With the data, they said they estimated the percentage of residents enrolled in Medicaid in rural and small town areas compared to metropolitan areas. In Wisconsin, it's about a third of children in rural areas enrolled in Medicaid. There's a misconception, some people say, that Medicaid is more important in urban areas, when in fact, most counties in northern Wisconsin, a largely rural area of our state, have more than a third of children enrolled in Medicaid. By county, Milwaukee County, an urban area, is the largest with 47% of children enrolled in Medicaid, but that's followed by Menominee County and Adams County, both very rural counties. The report comes days after Republican leadership in Congress proposed dramatic cuts to Medicaid as part of a strategy to fund other policy priorities, despite Medicaid programs being a critical part of revenue for our state's rural hospitals and healthcare providers, and of course the fact that many of these patients would be uninsured or unable to pay for care without Medicaid. Medicaid provides healthcare coverage nationwide to about 80 million Americans. The Children's Health Insurance Program picks up even more children who are just out of eligibility for traditional Medicaid. Both programs are funded jointly by state and federal governments and are managed by states under federal rules. You can read that new report. We link to it in the description below.